All right, let's do it. So, hey, everybody, welcome. My name is Austin Griffiths. This is the first annual Child Welfare Career Expo. We are excited and thrilled to see everybody. This is a great opportunity, and this is something that we've worked really hard at. And this is kind of the first time we've done it. So, at the end of the day, we're going to work together. We're passionate about this work, and we want to bring people together. So, we've got some great folks in the community. We've got some students that are here, and we're really excited about this. So if you don't know much about our center, we want to tell you a little bit about it. If you don't know much about these community agencies, we can't wait to let them talk about it. And we're really, really excited to connect y'all. And if you don't know much about WKU or our students, we got the very best, and that's the truth. So here they are. And this is really something that we're really passionate about here in the College of Health and Human Services, but just across the university in general. Child welfare is so important. It truly belongs to all of us. It's something that we're very passionate about. And there's a lot of agencies in the community that are doing a lot of really meaningful, important work. So what we want to do is we want to bridge the gap. We want to connect students with employers that are out there doing important work. So you might be interested in finding a job today or now or later, or you might just be thinking, what kind of services are out there? What can I learn from today? So that there are a lot of different kind of paths or intentions on behalf of today, and we're excited about all of it. So again, my name is Austin Griffiths. If I can do anything at all to help you, I definitely will. We're going to talk about our team and some other things here in just a minute. But one of the first things that I wanted to do was definitely thank you for your time. We have a lot of decisions to make. There's a lot of places you could be right now, but from the bottom of my heart, thank you for being with us for just a little while. It really means a lot. And we hope that this is meaningful and is something that is valuable for you. And another thing we want to do is we want to ask Dean Tanya Boss if she would just say a couple of words. We really appreciate her and her leadership here in the College of Health and Human Services. Dean Bossa, could you maybe say a couple of things for us to kind of kick off this initial Child Welfare Career Expo, please?
Absolutely. I'd be delighted to. So good evening, everyone. I'm honored to welcome each of you on behalf of WKU and the College of Health and Human Services to this first annual Child Welfare Career Expo sponsored by the Center for Child Welfare Education and Research. And a special thank you to Dr. Austin Griffiths for planning and implementing such a wonderful event to connect our students and community partner agencies. And for our students and for all of our agencies, obviously you all know our students have chosen a noble career, one in which their entire job is devoted to helping others. Students, I wish you all the best in your future endeavors and hope that once you're out working with our partner agencies that you'll stay connected to our Department of Social Work, CCWare, and CHHS. So we'd love to have you come back and share with us and current students your professional successes, and perhaps you will be attending one of the future Child Welfare Expos in an effort to recruit one of our future students. So enjoy the event, and of course, go Tops. Dr. Griffiths.
Hey, thanks, Dean Boston. We appreciate it very much. Thank you.
Yeah, I hope you all enjoy your event. It's nice to see your smiling faces, and hopefully one day we can do this in person so I can meet all of you face to face. So with that, I bid you all adieu and have a great evening.
Thank you very much. All right. So the next thing I want to do, because I think it's very appropriate, is this is a career expo. And the goal is to connect students, right? And excellent community agencies that we have specifically worked with and asked to be a part of this. So real quick, what I wanted to do is I wanted to mention and acknowledge 3 of our student representatives that have worked really hard over a period of time. So for that reason, I wanted to ask if Ryan, could you say just a word or two? Maybe say what's up, say hello, say something. Ryan Flower is one of our student representatives for the center, and you're definitely someone that's worked real hard at this. Just say something real quick for us, please.
Yes, sir. Thank you very much for letting me have the opportunity. My name is Ryan Flower. I'm a MSW student here at West Kentucky University. Coming up on the end of my first year of 2 years here. Child welfare, I'm very impassioned about it because for when I work at the Hardin County DCBS office as protection permanency worker, this line of work is very important to me, and I'm enthusiastic. I've been enthusiastic on this project and wanted to see this go forward, and so enthusiastic to see how this is going to work tonight and speak with you guys and have these students speak with you all as well to see how important and how important this work is for us. Thank you.
Thank you, Ryan. Appreciate that. All right, Sherry Youngblood, another one of our student reps. Sherry, can you tell us something good, please? But you might have to unmute.
Should be
We're
good to go now.
Work on. All right, there you go. You're good now.
Okay. Hi, I'm Sherry Youngblood, and I'm a graduating MSW student. So, and I'm employed with the cabinet. I've been with them for about 5 years. But I think this is just a wonderful opportunity for students to kind of learn about what jobs are out there for social workers.
All right, thank you very much, Cher. And last and certainly not least, student representative, we just wanted to ask Emma Smith if she'd say something about kind of what we're trying to do and the work we put in. So we're really excited about it. Emma, can you say something real quick, please?
Hi, y'all. I'm a BSW senior at Western, and I'm also a public child welfare certification student. So I'll be working with the cabinet after I graduate, and I'm really excited for this event, and I'm glad you all are here.
Thank you very much, Emma. Excellent. All right. So what I want to do real quick is I want to highlight a couple things, and I want to talk about some expectations. If we're going to get the show on the road, I'm going to quit talking. So it's going to be fun because I know y'all didn't come here to listen to me, but that's good. So we're going to do it. So a couple things. Today is really going to be an opportunity to hear from. We have 9 agencies that are going to be here. So what I'm going to do right now is I'm going to share our agenda, and that's generally, for those of you that know me, the way that I roll. So let's pull that agenda up here. Hopefully you can see this here. Can y'all see that agenda right there? Hopefully. Okay. So this is generally what it looks like. We're doing the welcome inductions real quick, and then we have 9 excellent agencies. They're going to have a conversation. And at the end of each agency, we would like to have an opportunity briefly for some questions. So we think it's the cleanest way to do it is for students to type their questions into the chat box, right? So for example, if I'm with Barren River Area Child Advocacy Center, and I'm kind of talking about what we do and stuff of that nature, and then I'm done with that portion of it, then in the chat box, there might be some prompts or some questions, and then we can go on to the next. So we want to be good stewards of each other's time. We want to be respectful of each other, but we also want to be efficient and kind of do that stuff. So that's kind of the way we'll do it. Again, this is something that we're learning, but the whole point in here is to kind of work together and kind of do our best to kind of support each other. So in the broadest sense, this is something that we're going to work together to do together. But at the end of the day, if you have questions and you're able, please put them in the chat. If you're unable to do that, if there's some accessibility things going on, or if you're on a phone or something like that, reach out to us one way or another. And certainly we can do our best to work with you. This is something that's professional, and we want to make sure that we can record this and send this to students and potentially put it on the website. So there's an expectation that there's no, disrespectful or unprofessional things that are happening. That should probably go without saying, but I felt the obligation to say that anyway. Oh, and after this, we're going to be sending out a quick anonymous voluntary survey. And if you fill it out, you're going to be in line to get to be for a drawing for some Amazon gift cards. And there's going to be 5 of them. So looking at the number, I mean, we've got some people on here, but it's not just one gift card. So for those of y'all that are statistics folks, there's 5 gift cards that you could win, and there's also bags of swag. So for example, you're probably going to have a really highly likelihood of getting something. So we're going to be sending out some surveys, and really the point of the surveys is only to help us to improve this, because we want this to be valuable for our community partners and also for our students. That's the whole reason we're doing it. That's it. That's it. So let me mention my team here at the Seaware. And then what we're going to do is we're going to get out of the way and we're going to get on with it. So we really, really appreciate y'all. Let me go ahead and share these slides and make sure that we're good with that, please. All right. All right, very good. So April 12th, this is it, the inaugural Child Welfare Career Expo. Something I wanted to say just real quick is that the Center for Child Welfare Education and Research has a leadership team. These are us. This event is not about us, but what I want to do is just kind of put some names with some faces. If there's anything that we can do to help you, we certainly will. So please reach out to us. And the next thing I wanted to do was mention our scholars who are viable contributors who are across the university at WKU. They have a lot of varied professional backgrounds. As you can see their names and faces here, really excited to have them on our team. This Applied Research Center is about connecting people, connecting the community, and doing good work. You're talking about right here, nursing, psychology, communication sciences. This is something that we're really passionate about, bringing the community and bringing together people, because we know that truly child welfare belongs to all of us. So I am going to not speak anymore. And what I'm going to do is get out of the way, because I'd like to hear from the Child Advocacy Center, if that's okay.
Yeah,
Is that good?
that's great. I hope you
Okay.
can. Hey, I'm still having a little trouble with my laptop. So of course, that's those things go, but thankful for your including us today. We always want to be where the best students are, because we want to have the best service delivery in the Barren River region when it comes to children facing trauma after child abuse, right? So we are typically the first place that law enforcement or social services would call after an allegation of child sexual abuse and serious physical abuse. So about in 1998 is when the center here locally started. There are 15 in the state of Kentucky, and the CAC movement is national. We are part of the National Children's Alliance. And so as part of that, we undergo a reaccreditation every 5 years, which we just recently did again, to make sure that we are following the NCA standards for service delivery by children's advocacy centers. And we want that to be top notch. So the best forensic interviewers, the best possible medical exam, and the best possible mental health therapy for children experiencing abuse. We are one safe, child-friendly location where the adults, I like to say, have to come together to serve a child, rather than, as it used to be, a child having to go to the police department or be interviewed where a perpetrator might have just been or be again in short order, having to go to the emergency room, all those things. We want them to be able to come to the center and have the adults come to them. So we provide live monitored forensic interviews. So all of the team members, we call them multidisciplinary teams, work together to watch those interviews. And but the child is in a room with just an interviewer, so it's one-on-one. And then the team can work together to work through these complex cases and all the things there are to consider when considering the best interest of the child. So we've really worked hard to update our equipment, update our building. We're in an old church at the corner of 12th and Adams. So what used to be Kerr Memorial Methodist Church. But we have a beautiful 11,000 square foot facility, and almost every inch has been recently updated thanks to the Victims of Crime Act. So we are really, I feel like, in a good position. We have diverse funding to sustain ourselves for years to come. So we really do need the best people. We aren't currently hiring at the moment, but it will be likely that we would be soon. Are there any questions at this point? You asked us to pause, so I want to make sure I make time for questions.
No questions so far.
Okay. So career opportunities with us might include a forensic interviewer. Right now, we do that on a contract basis. So as interviews are requested, they are scheduled typically about 2 weeks out. But we stay pretty consistent with that. During the pandemic, of course, we saw a decrease in reports statewide, but locally we saw a 92% increase over one quarter when kids returned to school for those forensic interviews. So we know that kids being around other adults that they're able to tell makes a big difference in our services being requested. So we're looking probably at another significant increase now that kids have returned to school 4 days per week. You asked us to tell a little bit about why students would want to work for us. I feel like because we are serving children locally, you can really see the difference we are making. you can feel that as children come through the center, you can see that healing take place and see children move on to a better situation. And that, of course, is something we all want to see. Kentucky ranking first in the rate of substantiated child abuse for the third year in a row, I think is a reason also to get passionate about this issue. You know, we want to determine more that can be done to prevent child abuse. That's kind of a smaller part of what child advocacy centers do, but it is a part of what we do. So we have started education for children ages 4 to 8 and for parents who, or really just adults who interact with children in our community with the program called Darkness to Light. We also provide advocacy, child advocates, we call them. So that would be a varied background, but certainly an opportunity to work directly with families and children who are impacted by child sexual abuse. If resources were not an issue, ask what would we do? And well, we're eyeing the 2 buildings next to us. I'd love to buy those and have a crimes against kid unit. I'd love to expand our parking lot. We'd love to add more therapists. We're almost always on a waiting list. So more trauma-informed therapists in our area and more prevention efforts, I would say. So we have a big vision and we're just getting started. So
thank you, Jennifer. I see a couple questions for you too, if you're ready for those. Okay, I don't know if you can see the chat, but I'll read them to you if you want me to.
I can't see it. I'm sorry. I'm on my phone.
You're okay. You're good. All right. First question. What counties do you serve?
The Brad region. So the Barren River area ad district.
Okay. And let's see. Second question. What would you need to become a forensic interviewer?
Well, typically that is a background of a therapist, a social worker, and very specific training that we provide. It's an extensive 40-hour training to start with, and then ongoing training. We provide a lot of training. That's something I failed to mention, but there is a lot of growth and training encouraged, a lot of training that is required by our grant sources. So that's something that's ongoing. So typically a background in therapy or social work.
Very good. Thank you. Oh, more questions coming. Does the LaRue and Hardin area have their own district?
Yes. There is a map available on cackentucky.org that would show you where all of the child advocacy centers are throughout the state. And I should have mentioned our website, BRACAC, BRACAC.org. We have a lot of resources there about reacting to child sexual abuse, just all kinds of resources, and it lists all of our staff and gives you a good idea of more information about the center.
All right. Oh, more questions coming. Do you need, it says, so we need a master's degree. I don't know if that was related to the forensic interview a bit or not, but Sable had asked that question. So
I said that, yes, a master's is required really for most of our positions, not our advocacy positions. There are some entry-level positions for sure. Certainly our prevention advocates would be entry-level without a master's, but for the forensic interviewing, yes, that would be required.
And Caitlin asked this, are there any volunteer opportunities?
Yes, we welcome student interns. We have lots of volunteers who help us throughout the year for our fundraising events. We collect a lot of teddy bears throughout the year with our great teddy bear ride and our Over the Edge fundraisers. So we're often out there asking for volunteers and welcome them in the center.
Thank you so much. This is great. Okay, so I don't know if I've mentioned this yet, but what we're going to do is we're going to make sure to have everyone's information on the website. So you have direct contact information for everyone here, as well as their websites and everything else. And I think this might be the last one we have time for. So there's one more. Do you have any summer research internships?
Perhaps. Certainly reach out to us. Myself or Heather Webb could help you consider that.
All right. Very good. Thank you so much. I appreciate it.
Austin, thank you for having me.
You're very welcome. All right, cool. Excellent. All right, so let's move. And we have Home of the Innocents. And let me show this sweet graphic, this logo that we've got here. And then we will ask Home of the Innocents, right? Excited to have
Okay.
y'all. All right,
Thank you.
Are you ready? Let's do it.
Yes, sure.
All right.
Good afternoon, everyone. I'm Natasha Cummins. I'm the business partner, which is the people department, which we call HR. We're located at 1100 East Market in Louisville, Kentucky. So Derby is a busy time for us, may be busy now since a lot has changed with the vaccine. But in reference to us as at the home, just to share with you a little bit about our mission and vision, the Home of the Innocent enriches the lives of children and families with hope, health, and happiness. The Home of the Innocents is a leader in transforming communities through programs that are trauma responsive, innovative, and evidence-based. We drive change and inspire our stakeholders to take action. Our leadership is committed to developing and supporting a diverse and inclusive value-led workforce. Some of our values are, we have four values, which is compassion, wellness, empowerment, and excellence. Just to share with you a little bit about our history, on April the 23rd, we will be celebrating 141 years
Wow.
here in Louisville, Kentucky. So it's a big celebration. We celebrated last year 140, but it was founded in the 1880 by Dr. James Taylor Helm, who was a minister of Christ Church of Louisville. So that's just a little bit of a history. And in reference to our over 140 years, we have been serving 600 children a day. We also last year served and took care of 10,500 vulnerable children and families. And just to add a little bit more statistics with you guys, we also work 24 hours a day. So a lot of our facilities, even the ones here, do that just so we can take in like emergency shelters. We have residential treatments. We work with youth from birth to 18 years old, as well as we had 97 youth that we work with directly in residential treatment. We have behavioral services, as well as we operate with foster care and adoption services. We also have another department with us. It's called COSAIR, Charities Pediatric Convalescent Center, which we call KPCCC at the home. And that provides services for 0 to 21-year-olds as well. That are very fragile youth. So having that compassion and love to work directly with our youth is important. We also have residential. So we have youth that stay in some of our cottages, as well as we have community-based services available and work directly with the homeless. So we have a service that we provide for 18 to 24-year-olds, where we provide education, job, and housing for homeless youth. Just to share a little bit more about us, why is a great thing to work at the Home of the Innocents? Working at the home is a life-changing experience. Every team member of our organization is making a difference in the life of a child and a family. We empower our clients and each other. We show compassion and excellence as a dedicated to our careers and improving the lives of those who are the future of our community. Now, in reference to me, just to share my story, when I came to the home, and a lot of y'all may want to do this just to get the experience, I worked full-time at Kentucky Career Center and part-time here at the Home of the Innocents. It gave me an idea as a resident counselor to say, hey, is this a place I want to work? You know, so you get a feel like volunteering or even working part-time within that organization. So it gave me a clear picture that, hey, this is a great place to work. And so when the business partner or the HR position came open, I applied because that was part of my background for my previous employer. In reference to family, I have children. I have a husband, twin girls that are in 11th grade, getting ready to take their ACT. I have a son who actually plays football for UK. So not to talk, but he also was offered at Western Kentucky. So he made that choice and he has to live with that. And I'm happy for him, you know. And then we also have a dog named Titan. He's a Rottweiler. So our lives are very busy, but you learn how to balance that and embrace the work that you have. And if you are passionate about it, it's not work. It's something that you love and you care for your kids. So it's very important to select a job that you're passionate about and that's something that's going to make a difference. And that's why I chose the home, because making one difference in one child's life is a big difference. And it makes a lot of changes in the community that we live in when we make that impact. The other thing I wanted to share with you is what makes us unique. The Home of the Innocents has been a stalwart of Louisville for over 141 years that I mentioned earlier. And our organization is working towards being more diverse, inclusive, and equity-centered organization. As you can hear, there's maybe a little accent coming from me. I don't know if you can still hear it, but I'm originally from Nassau, Bahamas. So we have people from all over here at the home, and we embrace and we are compassionate about the refugees, individuals that come from all over, and support one another within our organization, because we stand strongly on DE&I. Just to share a little bit more about us, the home is on a multi-year journey towards becoming a sanctuary model that is becoming a certified organization. So the sanctuary model I can share with you later on if you have questions about that, but that's a great model to kind of put us on the pedestal of where we're standing in regards to taking care of us internally, as well as taking care of the community externally. In regards to opportunities at the home, as I mentioned before, there's a number of different opportunities. You can check out our website, which is on www.homeoftheinnocents.org website. And this is where you can make a difference in hundreds of children's lives that we work with directly on a daily basis. Some of the positions that we have at the home, just to name a few, we have residential house supervisors, program managers, but also in skilled professional type of fields, pediatric nursing, social services, administrative, etc. So there's a wide range of opportunities here at the Home of the Innocents. And what we're looking at moving forward within our organization is at the Home of the Innocents, we see ourselves leading this state of Kentucky in a transformational change to its child welfare system that prioritizes prevention of abuse and neglect to greatly reduce the number of children who are removed from the custody of their parents. We want to create equitable communities that nurture families and appropriate resources. Thank you. And if you have any questions, don't hesitate to reach out.
I think you're muted, Austin.
Appreciate that, Ken. All right, thank you so much. There's a question here, so let's make sure that if you want to speak to it a little more, it says, what can a BSW student, so that'd be Bachelor in Social Work student, do there? I've been looking at the Home of the Innocents, so I didn't know if maybe you could say, maybe speak to that, an undergraduate Bachelor of Social Work student, maybe there's some opportunities for that specific kind of criteria or situation.
I would say the starting point for individuals within the home is the resident council position. That kind of gets your feet wet, saying, hey, is this something I want to do? We also have community-based services, and we also provide supervision. So for individuals that need to get supervisory assistance within the home, we provide that as well. At times, we also offer internships within the Home of the Innocents as well.
Great.
You're welcome.
Maybe time for one more question. Anybody else got one? Oh, there it is. Do you just have a location in Louisville?
Currently, we do.
And it's been there for a while.
Yes.
Yes, indeed.
Previously had some locations in Indiana, we did more of the clinical specialist part. I know that facility had recently closed down from all the, all the chaos everybody's been experiencing. So, but we did not displace those folks. We actually brought them back here at our location to work with us. So we try very hard to take care of each other and to look out for each other.
Excellent. Thank you so very much. I really appreciate that. Again, if there's anything that we can follow up on, we'll be putting information on the website, and y'all surely know how to effectively seek these folks out. So that's what we're all about, connections for sure. So next up is Rivendell. Let me show you a quick image of a place that I've been several times. Rivendell Behavioral Health Hospital. All right, Rivendell, let's do it. Where are we at here?
It's Heidi. She's muted.
I was gonna
Oh,
say,
he's
remember that
muted.
game show with the don't? We could always do that.
How about now? How we doing?
Yep, there we are.
There you go.
All right. Okay, that was good. That gave me a chance to just fake you guys out and pretend. So I'm going to repractice that. So, yeah, my name is Heidi Coleman. I've been at Rivendell for about 5 years now. And for those of you who don't know, Rivendell is a psych hospital that is located in Bowling Green. It is one of the UHS facilities. UHS is the largest psych hospital organization in the world, having locations in US, Puerto Rico, and UK. In Kentucky, Rivendell is one of several. One of the things I would like to point out, though, and one of the things that we're very proud of is having over 350 UHS facility. Rivendell has ranked #1 in patient satisfaction consistently for a while. So we take a lot of pride in that. So just because we are a part of a larger organization, there's a bit of competition that we face between each other. And we take a lot of pride in the quality of care that we do provide our patients. Our mission statement is to provide superior quality healthcare services by demonstrating service excellence. The primary standards that we use for the service excellence are to focus on treating everyone as a guest, demonstrate professionalism and excellence in everything we do, and then we practice teamwork. So I don't want to go on a big dry spiel for you guys. I'd like to be able to answer some questions, but I will tell you that in our field, we have worked hard. Rivendell is on the forefront of UHS facilities of trying to incorporate a blended model into our work. What I mean by that is psych hospitals typically have a very medical-based focus. And what we are working to do is incorporate a blended model that includes the behavioral management programs, the social services work, in addition to med management. So that brings into play the element of the social services, the social workers, the clinical clinicians and people like that. The value in what they do is being placed on an equal platform with the nursing within our facility. From a management standpoint, all the way down to the direct care of the patients that we serve, we use that blended model to try to help patients recognize the value of med management as well as behavioral interventions. We are a facility that is open 365 days a year, 24 hours a day. We've been in business for over 30 years. I'll tell you that the population we serve is currently at this time, it is only an inpatient facility, and we have 6 different units. Those include, and I'm telling you this so that you may want to have experience with a variety of populations. Those that we work with right now include a sex offender treatment program for adolescents. Those are folks that have actually offended. We have a younger age group that we work with that is a shorter length of stay, and they are sexually reactive. And some of them have in fact offended, but they are a younger age group. We have the adolescent acute psych. That is a short-term stabilization program. We have the children's acute psych. We have one adult program, and that is dual diagnosis with substance abuse, obviously being the primary. And then we have adolescent dual diagnosis. The length of stay for all of those programs vary. From a clinical therapy standpoint, the entire hospital works to incorporate DBT into all of our units and all of our focuses with each population. Part of the reason why we do that is because DBT has an enormous number of coping skills. A lot of those little acronyms work for a lot of different populations. So on top of the DBT, the other thing that we do is we use evidence-based treatments in all of our units. The adolescent substance abuse works on 7 challenges. There's an SOTP training, et cetera. We take a lot of pride in offering a lot of education, additional training to all of our staff. And it's a great opportunity, honestly. We've had a lot of folks from the Western program to get their foot in the door, to get some field experience with a variety of populations, a variety of different diagnoses and types of people to work with. And then also we're able to help facilitate the internship program to offer some hours in that way. So We do offer, I should tell you that we basically do an orientation once a month. We are constantly hiring. Like I said, it's a 12-month, 365-day-a-year facility. So we try to constantly offer opportunities for people to come on board. We do have some turnover because we work so closely with so many students. We work around what school schedules are in order to have students on site in order to getting that experience. I can't imagine that there aren't some of you who have already worked closely with people who are here if you're in Bowling Green area. How about I let some questions be asked, Austin?
Yeah, let's do it. So so one of the things, I know that our field director's on here, so maybe Kelly, I don't know if you have access to the microphone or anything. Keenan might have to make you live there. But one of the questions as well, Heidi, I'd see if Kelly can speak to this too, kind of jointly, but it says, are you guys taking any students for volunteering or field placements? I don't know if Kelly, you want to speak to that maybe? And then we could pass it back to Heidi here in a second.
Yes, that would be great. So I do have contacts there at Rivendell. We frequently place students. I don't know what I would do without you all. So I do appreciate that partnership with Rivendell and the social work department for student placements. So as well as many of the agencies on tonight, actually. So let me go ahead and do that shout out to all of you. So yes, Rivendell often takes several students, and I'm working with contacts there for those social work student placements that are in process. I think we are probably about full for BSW students for the fall, but there's still some opening for some MSW student placements for the fall at Rivendell. So I'll go ahead and interject that piece. So nice to see you, Heidi.
Yeah. You too. So, yeah, and I will elaborate if we're okay with that.
Well, sure. Well, sure.
So what a lot of folks do is when they are getting their bachelor's, or even while they are in the middle of their master's, a lot of folks will begin as an MHA for us. That's a mental health associate. So that is a paid position, and it varies. It can be a PRN where you work every other weekend. We have first, second, third shifts. Like I said, it's 24 hours a day. We do part-time, we do full-time. We can help you cut and paste a schedule that works with your school so that you can have your foot in the door to get firsthand experience with patients. And then days that you aren't scheduled to work the floor, that you're not in class, what we will do is we will pair you with someone through your department with our supervisors here on site in order to allow you to get those hours that you need for practicum and internship. And we do that with not just the social work department, with other departments there on your campus. I don't want to get competitive. My letters are LPCC and LCADC, but we have a wide range of folks that work here with a lot of different letters. So we certainly welcome all people in those fields and encourage them to get their foot in the door as an MHA. As far as the clinical opportunities, we have our therapist team, as far as the actual hands-on therapists that carry a caseload, we have 13 full-time therapists. They are required to have a master's level, so we have CSWs as well as LCSWs. And then all of our admissions and referral department at front are required to be master's level clinicians as well. We have some opportunities in case management that do not require a master's degree. We don't have a lot of turnover in that area. The rest of the hospital, the MHA floor work, we have a lot of folks that are early on in their education, and like I said, just trying to get their foot in the door so that then they can be placed with us for that internship, because it's a pretty competitive deal out there. Getting that MHA slot and working on the floor really kind of it really kind of shores up that opportunity with us.
Excellent. Thank you, Heidi. I think you may have already spoke to some of these, but let me go ahead and read these questions respectfully. So one of the questions is, what can a BSW student do there? So you may have spoke to some of this, but is there anything else you'd like to add given what you've already said?
I think not. I think being an MHA is the first foot in the door. I was a therapist doing outpatient and wanted to get started at Rivendell. I'm getting old, so I like benefits and the security of a large organization. So I, in fact, came to Rivendell and started as an MHA even with my license. So it's an opportunity to really get a firsthand experience of the patient and what is going on the floor in a facility like this. So I would encourage any of you, if you're looking to just get a feel for it and just to get the entry level, apply online. It's rivendellbehavioral.com. We have multiple MHA lists.
Uh-oh.
Might have lost connection with Heidi.
We might have lost connection with Heidi. Ryan, I don't think we were going to get to your question, so we might need to reach out to Heidi. Oh, there she is. Heidi, you back?
I'm back.
Heidi, do you think you
I
can
don't
answer?
know how far along you guys.
I think we got
Go
it.
ahead.
Do you think you could answer this one real quick? Ryan asked,
Okay.
do y'all provide supervision for LCSW hopefuls?
We do. Absolutely, we do. As long as you guys send those folks to us and tell us that you want us to provide that, we will certainly do what we can to help you guys as well as your students. You know that.
All right. Thank you so much for your time. We really appreciate that very much. And again,
Sure.
we can go, let's see here. Can you repay the, I'm getting something.
Rivendell.
Okay.
Yeah, it's Rivendell Behavioral. So RIVENDELL, rivendellbehavioral.com.
Thank you much. And feel free to type it in the chat here if you are able to. All right, let's do it. So I think it's time for life skills. I'm going to pull up, I believe life skills has a couple of slides too. So let me pull that and y'all can just tell me. I will do whatever you tell me to because I'm good at that. So let me pull these up here and we're excited to hear from y'all too. Let me go ahead and expand these. So I don't know, when y'all start talking, they might be able to see you, but just tell me if I need to do something different. So, all right, the floor is yours, life skills.
All right. Hello, everyone. My name is Robin Gregory. I am the Director for Children's Services with Life Skills. I've been with them for 22 years. Just to give you a brief history of who we are as an agency. We are the private nonprofit corporation that serves this area here in the Bowling Green and Barren River area. We currently Life Skills covers 10 counties. And then we just recently merged with another company that covers another 8. So together we service 18 counties. And Austin, if you want to put that slide up
this way
for us. Yep, that one. So you can see there, Life Skills covers those counties in the green: Warren, Logan, Simpson, Allen, Barron, Hart, Edmondson, Butler, Metcalf, and Monroe. The Pennyroyal region, who we just merged with, covers Crittenden, Caldwell, Lyon, Trigg, Todd, Muhlenberg, Hopkins, and Christian. We've been around for a long time. It was 1963 when President Kennedy signed the Mental Health Act, thus setting aside funds for the states to reach out to serve the mental health needs of folks in their communities. Life Skills can trace its roots back to 1966 when we were formed by the state of Kentucky. Our Life Skills group was formed around Bowling Green and around the Barren River region. And there was another group that was formed around Mammoth Cave. They operated independently for a few years. And in 1971, both of those counties merged, and Life Skills was formed back in 1971. So we are tasked by the state of Kentucky to serve the mental health needs of the folks in our communities. And so we serve folks from birth until death, basically. We service kids with mental health needs. We service adults with mental health needs. We do addiction work. We do services for our MRDD, intellectual disability population. We have crisis work that we do 24 hours a day, 7 days a week, for both the adult and child populations. And so I'm going to pass the baton over to Katie. She's my counterpart, and she's going to talk a little bit about services.
Oh, perfect. Thank you. So these are the services that we provide at Life Skills. As Robin said, we've got a mix of both inpatient and outpatient options, as well as various populations like, children and adults, the addictions population, mental health, behavioral health. I know we're seeing a lot of dual diagnosis, where we're struggling both with substance use and mental health struggles. So as you can see, we do a lot of people think of us just as therapy, but we also provide psychiatry, case management, community support wraparound, peer support. And so it really can be a good wraparound approach to help families. We partner quite a bit with, again, several people on this call, but we've actually got several grants that we're doing through the system of care. So we partner a lot with social services to support families that are struggling with being at risk for removal. So doing everything we can to try to help them be able to maintain in the home, and that the family has everything that they need to, be safe and well, and be able to kind of maintain custody of their children. And then
next slide.
Yeah, next slide, please.
Yep, you got it.
All right. And so from like job opportunities, there are a ton of opportunities just because our agency is so large. From the indirect side of, our clinical support staff, so like our receptions and our billing folks. We have a call center that handles all of our intake calls. We went to a centralized intake process, or centralized call center. Has it been 3 years now, Robin? 2 or 3 years. It feels like it's been here for a little bit longer than that. But and so people can just call one number and get linked up with what they need, which I think is absolutely fantastic. They're not having to wait which county I'm in and who serves what in what county. And so there used to be a lot of kind of cross purpose there. And so now we're able to streamline that a little bit. And then for our direct service, we have everything from starting with your internships, all the way up through becoming a therapist or being a psychiatrist. A lot of case management opportunities. There's a lot of growth opportunities in Life Skills. I love being able to see people come in either on an internship or as a community support wraparound or peer support. And as they're working on their education and growth, we've been able to watch them grow into case management jobs and into therapy jobs, which is fantastic. So those opportunities are there as well.
Stop sharing.
I think that covers. I think that covers all of that.
Well, let's see your face for a minute. No more slides for a minute.
Okay.
Well, thank you. Very good. Let's see if we got some questions, because I thought I saw some things going on in the chat over here. Oh, maybe a few things. Oh, slide please. Thanks, Katie.
Yeah.
Does LaRue Hardin have their own facility? If so, what is the name? So Haley asked that. I don't know. Maybe that's for you all. Let me ask her. Is that for?
Is that for us or is that for, go ahead,
maybe that was for.
Well, if you're asking about the Community Mental Health Center, they do. LaRue and Hardin are covered by Community Mental Health Center. It is called Communicare up in that area. The way that each state does it a little different. The way that Kentucky decided to do it is they created 15 community mental health centers that cover all of the 120 counties in Kentucky.
Mm-hmm.
Okay, thanks, Haley. She said, Haley said, yes, since they only served 18 counties. Excellent. Thank you very much. What other questions might we have? Anything else for the Life Skills folks?
Communicare is the kind of our counterpart. We're not the same as them, but they cover a different region.
Cool. Sable had asked about BSW, Bachelor in Social Work opportunities.
Yes, some of the positions that a bachelor's level person could do if you already have your bachelor's degree is case management for either children or adults. Also, behavioral health specialists, although that position's kind of in transition right now, but that's providing community support wraparound. So those are the two main ones that our bachelor's level folks would go for. But I know our crisis units have been really great about, because again, like, goodness, my brain shut off for a second. Like Rivendell was talking about, they got 24-hour programs.
Sure.
Our residential facilities also have 24-hour programming. And so we have a lot of residential associates that are working in school or working while they're in school. And so it kind of gives them an opportunity to kind of also get their foot in the door.
Sure. Thank you. Excellent. Couple more real quick. Do you all do the same things as Communicare?
Robin, do you want to talk
We
about
don't do the exact, we don't do the exact same thing because we're owned by our own board and governed by them, just like Communicare is their own board. So while we don't do the exact same thing, we do very similar things, and we have similar programs.
Thank you. All right, another one coming at you. Are you all currently hiring MSW graduates, and what positions are available currently?
Yes. we
Yeah.
have several therapist positions that are opening up or have opened up, and you can check, I'll drop it in the chat, but lifeskills.com that has all of our positions, and they're in various counties as well. They're not just here in Warren, but I know for sure Barron is also hiring, and also different positions for children and adults. So, and crisis is also looking. So yeah, if you like crisis work.
And I think I'm seeing a similar question. This is, are you currently hiring BSW graduates? Because, you know, this is what we're talking about today. Are you currently hiring BSW graduates?
Robin, do you know off the top of your head position wise? I think we've got some openings, yeah. But definitely check the website.
We do.
That's most up to date.
Yeah, we've got some openings for some BSW positions, especially in case management, working with both children and adults in the addiction population. Just one caveat, going to lifeskills.com will show you the positions just in our 10-county area. Because the merger with Pennyroyal's area is relatively new, we are still in the process of merging our procedures and getting everybody all on the same platform.
Thank you very much. All right, appreciate it very much. Moving right along. Thank you so much for that. We're putting some email or some websites here in the chat, and we'll move right on. So thank you for that. Again, we'll post some information on the website too, on our child welfare CWAR website. So Warren County Schools, Erica, let me pull the let me go ahead and show the fancy logo that y'all sent me real quick, and then we will give you the handlebars. So give me 1 second,
sure,
please. Oh yeah, Warren County Public Schools, school social work. Let's do it. So Erica, the floor is yours.
Yeah, give me just a second here. I'm going to pull up my notes so that I can talk with intention and purpose, because I could talk for days about social work, especially, but also about Warren County Public Schools. My name is Erica McComas Church, and I'm a district mental health counselor with Warren County Public Schools. I'm filling in today for Todd Hazel. He's the director of student services for Warren County Schools. He unfortunately wasn't available, and he knows that the Hill is near and dear to my heart and that I would do anything for the social work department. So he asked me to fill in for him. And so that's why you have me instead of him tonight. The vision of Warren County Schools, just simply put, students will graduate with the determination to succeed personally, intellectually, and professionally, to provide an engaging and inspiring and challenging learning environment which prioritizes safety, achievement, and opportunity. But most importantly, and why I'm here tonight, is that Warren County Public Schools believes that students' mental health matters and has a direct impact on their academic success and their overall well-being. And then our student services department is committed to assisting students by helping them remove and reduce barriers to success. So we are a pretty small team, but we are a growing team. We are very fortunate as a public school that our board of directors really values mental health and wraparound services and a holistic approach to education. So we're very proud of that. You know, as far as how our agency got started, I don't know. Public education's been a thing for a very long time. Student services has been a thing with Warren County Schools. I know one of my team members has been employed by Warren County Schools for at least 23 years. So school social work and mental health in schools has been around, I think, longer than people realize, myself included. But with the department growing and the need growing, we're definitely becoming more public with that. The populations that we serve. So we serve all students from preschool to 12th grade that live in Warren County School District. That's 14 elementary schools, 4 high schools, and 4 middle schools. So lots of people. We work to link and be that link between schools, home, and the community, and helping students achieve academic success. We provide kind of a form of leadership within the school with the development of discipline policies, mental health interventions, crisis interventions, and support services. Honestly, the services that we provide are so diverse in nature, and there's so many of us doing so many different roles that I don't even know that we could think of a service or a skill that we don't utilize on a daily basis. But we do definitely do case management, resource linkage, advocacy, mental health assessments. We also do threat assessments, or at least our district mental health counselors do. And that's like, if a student were to say that they were going to blow up the school or harm another student or something like that, it would be our job to assess the seriousness of that threat and make recommendations for interventions to get that student help, keep everybody safe, those type of things. We have truancy prevention, social emotional learning supports. We provide training to teachers. We take a lot of pride and invest a lot of money as an agency in being trauma informed, from our classrooms to our front offices. We provide family education. So we'll do like 1, 2, 3 magic or parent nights or family nights. During COVID, we found some really innovative ways to connect with parents and provide supports to them within their homes. We assist with mental health concerns, behavioral concerns, positive behavioral supports, academic and classroom supports, consultations with teachers, parents, administrators. We provide individual and group counseling, psychoeducational groups, specialized programming such as suicide prevention. We also do universal screeners. So like students might, they would complete like a Kucher's depression scale or something like that to help us identify students that might be struggling with depression or suicide. We also use other universalized screeners district-wide to identify internalizers and externalizers and just anything that we can do and learn about our students to make sure that we have them in the best classroom for them and they're receiving the best educational approaches that they can. We also provide transition assistance with places like Rivendell and Life Skills to make sure that when kids return from treatment or facilities that we are providing them with the resources that they need to be successful with that transition back. Let's see here. Tell us a little bit about why students would want to work at your agency. All right, so this is my favorite thing to talk about. So y'all brace yourself and I'll try to be brief, but it's such a holistic approach, but mainly the accessibility to youth, right? So we're providing preventative services, reactive services, treatment services, to at a micro, macro, all the levels, right? But that accessibility for me was a big draw, right? So a lot of times with the families or the children that we serve, there's a lot of barriers, right? For them to get services, whether it's transportation or money or insurance or whatever it is. With school, most families, children attend school and most families want their children to be successful in school. And so they're just right there. And it just makes it super easy to provide those services and to partner with other agencies too. in the past, we've been able to, it's been a little bit harder with COVID, but in the past, we've been able to really advocate to get mental health professionals in our buildings, to have agencies come to our buildings to do intakes and all kinds of things like that. I think what makes Warren County Public Schools unique is just that diverse practice opportunity, because you get to use every skill, the assessment skills, interventions, case planning, evidence-based practices on all levels, whether it's group or individual, and just alleviating family stress and child stress so that they can function effectively at school. And every interaction is completely different. Like as soon as I walk in the school building, I might, have a kindergartner that's having some separation anxiety, and I can provide an intervention right there, and they may not even know my name, right? But I get to help them separate and be successful that day. To our kids that have some significant mental illness or some mental health concerns or some big things going on at home. So you get all types of things. As far as job opportunities, my goodness, I hope I don't mess up anybody's titles, but we have family resource coordinators, we have school social workers, we have district mental health counselors, we have case managers, transition coordinators, delinquency prevention service workers, program coordinators, family resource youth centers. I think that's it. Our newest member of our team, we also have emotional support animals, thanks to some community partnerships there too. So Bo is probably our most popular team member. Everybody loves Bo and wants to spend time with him, whether it's staff or kids. We also provide training to staff. We also provide emotional support to staff. This year has been really difficult for teachers, as you can imagine. Most teachers are very motivated by their interactions with students and their academic success of students, and having their students in their little world, their classroom. And they just haven't had a lot of control over the academic platforms this year, and they're having to learn a lot of new skills and be adaptable and flexible very quickly, which is very different in the education world. In the education world, everything's calculated and it's planned and all those type of things. So that's been interesting to be a part of, and that type of thing. And I think the last part is, what would we do if we had endless money? Wow, what wouldn't we do, right? We would definitely have smaller class sizes, because I'll tell you one thing that we have solved, we can prove because we have the data now, man, that with that hybrid schedule, the smaller classes, kids just soar. They just soar with more individualized attention. Granted, they need to be there every day, but so I'm not saying that, but having that smaller class size and ratio is just amazing. We would expand student services. We'd have more therapy dogs, more mental health professionals, more evidence-based interventions, all the things, and more positions. Go ahead.
That sounds great. Erica, you've got a load of questions. Are you ready for this?
Oh, I am.
All right, here goes. So okay. Roderick asks, does an applicant have to hold a certification? I don't know what specific position that means, so they might need to speak to that, but there's your question.
Put our website in there too. So it depends on the actual position. So for our mental health counselors, we do the district, well, for social work, does require you to already have your LCSW, but that's more of a social work board thing than it is a Warren County thing, but recognizing the importance of that supervision and that experience that you get as a CSW. The school system, those interventions are quick, they're brief, it's kind of cheating you out of that experience. So you do already have to be licensed for those positions. My boss is also a LCSW, and he definitely prefers to have even BSWs to have their LSW, yes, LSW, for those positions, just because KRS says to practice social work, you should be licensed.
So I got another question that's kind of off of that. And I know obviously we wanted to make sure to be inclusive of all folks, because we know that it's so important that we've got all professional backgrounds, even though, you and I are social workers. But with that being
said, I'm just more familiar with those.
You're good. You're good. So the question is, can you work with a social work degree or do you have to have a school counseling degree? So that kind of gets to other things. I mean, obviously you're saying
Yeah.
that you can work with a social work degree, but maybe a school
Yes.
counseling degree.
Yeah. So we have lots of people with different backgrounds. Even our mental health, our district mental health counselors have different as what Heidi say, letters
Yeah.
behind their names. And even our case managers, we have some with the psych background. We have some with actually an education background. You know, so that can be very different for sure.
Are there, another question on that? Are there school psychologists working on there?
Yeah, so we have school psychs, we have behavior coaches, we have behavioral interventionists. Um, we have lots of different, but yes, we have school psychology too. We're just very, I guess, focused in what our role is.
Sure.
And so, like when we come to the table to support a child, the school psych would be there for the purpose of developing an IEP, an individual education plan, or something like that. The behavioral interventionist, who also has a teaching background, is there to help with the behavior management in a classroom. And then I'm there more for the mental health. You see how that kind of comes together. And then the family resource person would be there to identify if the family has any needs. Do they need more education about a diagnosis? Do they need electric bill paid? What do they need? That kind of thing.
Thank you. All right, so I think we got time for maybe two more. Let's try to get these in here. Are there any internships available to psych students or social work, sociology, just period? But the question is psych students. Are there any internships available?
You know, I don't specifically know that, but I would go to our Warren County Schools website and reach out to our central office. They kind of each department is very focused, so I'm most familiar with student services. But I knew they value education, so I'm sure if the opportunity is there that they would support it.
Okay, or we could work out an email. We could find somebody that could help them out.
Mhm.
Definitely. Okay. Do you all work with students and families during the summer break?
So that looks different for every position. So we're contracted a certain amount of days. So like my position, I work 186 days a year. Family resource coordinators or program coordinators, they work closer to 200 days a year. So it just varies.
Okay. All right. Last question. Do you have any open positions currently for BSW graduates?
So we do within student services, and there may be some other positions that would be relevant in a different department, but within student services, we have 3 current openings here in Warren County. And then I am at liberty to leak some information that hasn't quite been approved yet, but we're looking at adding 4 school social work positions. Now, those will be specific to school social work just because of the nature of those tasks that they will be assigned. But currently we have 3 posted.
Okay, very good. Very good. Thank you so much, Erica.
Yeah.
Appreciate that.
Thanks for having me.
Yeah, absolutely. All right, let's keep moving. So Bellwood and Brooklawn, I think, let me go ahead and show this, and then we'll make sure that Irene has the floor. So let me show this sweet image that we got here. All right. I like it. That's a good picture, isn't it? Those folks are happy.
Good afternoon, everybody. My name is Irene Wright, and I am with 7 County Services, Bellwood and Brooklawn. I have been with the agency for 6 years, and I am the Senior Talent Acquisition Business Partner. 7 counties is the largest of the 15 community mental health centers in Kentucky. Actually, we are the largest in the region from what I hear. Currently, we have about 1,700 employees, and the 7 counties does service the 7 counties that surround the Louisville area. And then we have Bellwood and Brooklawn. They do have, they are in Louisville, but they also have a site in Bowling Green. 7 counties have been around since 1978. And We deliver innovative, individualized, and comprehensive community-based treatment, support, and services for persons with behavioral health needs, including people with mental illnesses, children with emotional and behavioral disorders, individuals with developmental or intellectual disabilities, and adults and adolescents with addiction and substance use disorders. Our mission and vision is to work tirelessly to find solutions to life's most difficult and complex challenges, and also to continually help our community flourish one life at a time. We have been serving around 31,000 people together, 31,000 people annually. And let's see, the population, so child and family, we have divisions within 7 counties. Bellwood and Brook Lawn is part of our child and family division, which is our largest division. And then we have adult services, we have developmental, and then we have addictions, and then medical services. So we try to use wraparound services for all our different divisions, not just the individual division. Currently, we, because of COVID, a lot of our services are provided via telehealth, but we are hoping that by the beginning or the middle of the summer, that we are coming back in the office and we do face-to-face services. So because we are the largest community mental health, we have a variety of positions for both BSW and MSW students. Usually BSW students can be hired as a mental health counselor, which is, we call them mental health counselors, but they're called in other agencies, mental health associates, which requires a bachelor's degree. And then we also have case management positions, youth care worker positions, and some community support professionals positions. We do have what we call targeted case management positions, and those are available to Medicaid. And for that particular purpose, it requires a 1-year experience post-bachelor's, unless the person has a master's degree in either social work or psychology, sociology, or mental or human services. And then the master's degree counts towards that 1-year experience. We do work with the schools in the area, the Jefferson County Public Schools, Bullitt County, and Oldham County. And we did have social workers or therapists that they went into schools and provided school-based therapy. But because of schools were closed most of the year, we are not currently in schools, but we're hoping to be back in schools the beginning of the school year in August. So tons of opportunities for students. We do provide training. You can get, we have our own training department that provides an array of trainings. And also we do provide supervision for the students, or for anyone that has a CSW or an LPCA or an MFTA license, and they want to be fully licensed. Currently, we do have some openings in the Bowling Green area. We do have 2 therapists, and those positions require a master's degree with an associate licensure, which is the CSW, the LPCA, or MFTA, or if someone is fully licensed, you know, as well. And then we have 2 case managers. We do prefer experience, but we will hire a recent graduate. And the positions in Bowling Green, when they're not doing Zoom services, which is the telehealth services. They are expected to be in the client's home, and they serve the Brad area. Any questions for me?
Thank you very much. I don't know if I'm seeing questions, but we can make a call for questions. So does anyone have any questions for Irene? Emma Smith, not a question, just a comment. I was at Bellwood the other day and it is a beautiful campus.
Sure is.
Thank you, Emma.
Thank you.
Any other questions for Irene?
I will put our website on the chat for anyone interested in the positions with Bellwood and Brooklawn or with 7 county services. I will say the 7 counties we service in case any students are from those counties. Besides Jefferson County, we are in Bullitt County, Spencer, Shelby, and then what we call our hot location, which is the Oldham, Trimble, and Henry counties. Those are serviced out of our LaGrange office. So tons of opportunities for anyone that is looking to go into the mental health.
Thank you so much. Thank you very, very much. All right. Does anyone have anything? Are we good? Thank you, Irene. We greatly appreciate it.
Thank you.
All right. So next up is KVC. Megan, let's see here. Let me show this. We've got a image here, a logo, and then we're going to pull up this infographic if that's what you want me to do. So let's go ahead and pull this up. KVC, you want to go ahead and show that logo for you too? I squeezed it out left and right, so it's kind of looks like that.
Awesome.
So
Oh, it's so good to be here with you guys. I feel privileged to be in the company of such esteemed colleagues, and I've been in child welfare and behavioral health work for the last 20 years in Kentucky, and have had the opportunity to work with many providers that are here tonight. I will say, and if you don't know this already, that you are in the midst of somewhat of a celebrity in child welfare here. Dr. Griffiths, I'm actually in school getting my doctorate, and as I am doing research in the field of child welfare, retention and turnover, Dr. Griffiths' work shows up all the time. And so I had the real privilege of being connected to him by my mentor and a professor of his in his doctoral program. I'm grateful for the opportunity. I think, again, KVC is probably the newest kid on the Western Kentucky block. A little bit about our organization. We started actually about 20 years ago as a private for-profit practice providing what's known as Impact Plus services. So some of the organizations here also provided Impact Plus services many years ago. This program was designed as a Medicaid carve-out to provide in-home wraparound behavioral health services to children who are at risk of acute psychiatric or long-term residential placement. In 2009, our organization met and merged with KVC Health Systems, which is based out of Kansas. And everyone always wants to know, what does KVC stand for? Well, I'm here to tell you that KVC started 50 years ago in the Kaw Valley in Kansas. So KVC originally stood for Kaw Valley Center. However, we say now we're 5 state subsidiary companies. So KVC Kentucky is actually a subsidiary of a health system. We have companies in West Virginia, Nebraska, Missouri, and Kansas, and we have psychiatric hospitals there in Kansas. And then our primary work in the rest of the states is either therapeutic foster care, or in the case of KVC Kentucky, it's family preservation, in-home behavioral health work. But KVC now, because we are so broad in our delivery and across the country, stands really for what our values are, which is knowledge, values, and connection. So we believe that we must have knowledge. We believe in our core values as a company and serving children and families well, and we believe that people strive for connection. So just in case you're curious, KVC, knowledge, values, and connection. So A little bit about our organization. Again, we were a private for-profit. In 2009, we merged with KVC and became a private nonprofit organization. We have 250 plus passionate professionals across central, eastern, northeastern, northern Kentucky, and most recently in Jefferson County, who provide behavioral health and child welfare services. So we're the largest contractor of the state of Kentucky, the Cabinet for Health and Family Services, to provide what's known as family preservation and reunification services. So despite what the popular belief in people who don't know about social work think that the cabinet just wants to come and take your kids. And actually the opposite is true. The cabinet wants to put all the supports in place so that children can stay in their families and in their communities. So in Kentucky, they contract with private providers to provide family preservation services to children who are at risk of removal for abuse and neglect. And KVC has the real privilege of serving more than 12,000 children and families across our service region. Our Lexington office is our hub. We serve Central Kentucky, Northern Kentucky, Northeastern Kentucky, and Eastern Kentucky. And then again, we have this incredible partnership with the cabinet, and most recently entered into a public-private partnership with Jefferson County DCBS to work with them to help them wrap up past due child abuse investigations. So we are really grateful and proud of our partnership in child welfare. We have an incredible success rate. So what you can see there in the little blue circle says 96% of children were either safely kept in their home or reunified with their parents. And when you talk about 12,000 children and families, we're talking about 11,000 kids. That is nearly enough to fill half of a stadium. And that's bigger than most of the towns in Kentucky, to be honest with you. So when you think about the impact of 11,000 children getting to stay in their homes, it's pretty significant. Again, we have master's level and bachelor's level staff. I would say that our primary goal is to come alongside families to provide intensive wraparound support, to create innovative and unique strategies for addressing families' primary needs, and to help them heal from whatever experiences they've had so that they can be stronger on the other side. We are a strengths-based wraparound approach. And I know for those of you in social work, at least, the word strengths-based gets thrown around a lot. And what that means to us is that we believe that every child and family, no matter what they've been through or has come through, has unique strengths that we can capitalize on with them to move forward in a way that will get social services out of their life and actually make their family stronger in the end. And the other thing that we do know is that when a child and family are stronger, a community is stronger. So we're really focused on creating innovative partnerships with everybody in our community so that we can create really unique interventions that are going to help families get past the crisis and become stronger so that the community can be stronger. I think, the question about what makes us different and why would you want to come and work for us, to me, are the same question, actually. We are rooted in evidence-based treatment. So we have a variety of clinical and non-clinical evidence-based treatments on board. We've been doing those services. I didn't say this, but I was actually a master's intern at KVC almost 20 years ago. And so I would encourage all of you students to treat the internship opportunity as a potential career, because I never thought that I would be in the same place in 20 years. I've had a variety of different roles, but you never know what the future and life holds for you. But since I've been there, we've been deeply rooted in evidence-based treatment. We want to do what works. We're driven by the data. We're focused on child and family outcomes. We're also really driven to innovate. And so we're one of the first organizations that had a proprietary electronic medical records system. We have a programmer on staff who programs our record. All of our staff actually work from home. We have 8 offices because that's required by our contracts, but our staff start at home and they meet with families when families can meet. And we believe that's one of the values of our services, is that we work in a way that decreases barriers of access for families. The other thing is we're a team-based approach. So we have multiple team members working with a family on really whatever the family needs in order to close their case or meet their treatment goals. We're certainly focused on continuous quality improvement and always striving to do better for children and families. So sometimes that means expanding services. Sometimes that means changing the way a program is designed. Sometimes that means creating new partnerships. And like I mentioned, our most recent program is this public-private partnership with Jefferson County DCBS to help them with the past due child abuse investigations. To my knowledge, this has never been done before in the country. And what we bring to the table is an evidence-based framework, high-quality assessment services. We have this incredible partnership with Sue Lorbach, who developed what's known as a safe and connected framework for consultation on child welfare cases. So we're innovative, we have partnerships. And then I think the thing that is really important about our organization is that we believe that we're family. So we're focused, we're employee focused. We are supervision and training driven. We really believe in the power of leadership development. So one of the interesting things, so I'm one of 4 leaders at KVC Kentucky. And again, I would say I've been there almost 20 years. I started as a student, but if you look across our leadership team, many of them started as students. So we have this really incredible program, student program, where I actually oversee that. I bring in 15 to 20 students in a cohort a year. They're dispersed among our teams doing the work in the field. Then we come together every week and we do process-based supervision. It's this really great opportunity to be amongst peers and have the support of your peers, but then also be submersed in an organization that's doing the good hard work. So we are focused on leadership development. We believe that our leaders should really, come from within the organization, people who strive to learn and grow, and who are committed to doing evidence-based treatment. And I would say, one last thing is that we're committed to the highest standard of care, no matter what. So something that really drives us every day is doing the right thing for every individual child. So our team is always available. There's tons of supervision and training opportunities and tons of support. And people often ask me, we're working with families who are really in crisis and working with children who are really in crisis and struggling every day. And people say, well, how do you sleep at night? And the way I can sleep at night is because I know beyond a shadow of a doubt, every person in our organization believes that they're going to do whatever it takes for that child and that family to be safe. So I have all the confidence in the world that that's happening every day. And then the one question was, if resources were unlimited, what would you hope to do? And I think for us, we would hope to be able to get into more preventative type work, working on the side. Right now, the families that we're working with have substantiated child abuse or neglect or maltreatment. I think we really would strive to get in on the front end of that and provide education support to all families, not just families whose children are at risk. And the other thing is we are really committed to integrated care. And so if resources weren't an issue, we'd have a full staff of primary care docs. We'd have, we are really interested in making sure that we're treating people holistically. So.
Thank you very much, Megan. I appreciate that. And thank you for the kind words. That was excellent. So with that being said, we've got some 7 counties hyperlink for a website over here. On behalf of Irene puts in Bellwood and Brookline career opportunities. And Sable has a question for you, Megan. So it says, where are your 8 locations located? And then let's start with that. Where are your 8 locations located?
So we have our Lexington-based office is kind of our corporate hub for Kentucky. So Lexington, Richmond, Moorhead, Ashland, Prestonsburg, Hazard, Frankfort. That should be 8. And then we also have space in the LNN building for anybody who's familiar with Louisville, because we are partnered with the cabinet there to do our reassessments for child welfare. So that's our 9th spot.
Okay, thank you.
Yeah.
And another question, which is the second question there. So does having a public child welfare certification program or PCWCP certification help with acquiring a job there?
So our programs don't require that certification, but I definitely think that the knowledge that you bring to the table because you've been through that program sets you apart. And so while, we're looking for the best candidate, and what I always say to our team who interviews and hires is that I think about the 12,000 children and families that we serve every day when I'm meeting with somebody, and I actually visualize them behind my back thinking, okay, Megan, would you want this person in your home? And so the most important thing to me is that we have the most committed, most highly qualified person. And I think what you bring to the table with that certification is knowledge and skills, but we won't hire someone who we wouldn't want to work with our own family. That's one of our core values, is what would you want for your own family? So even if you have that certification, but you may not be the best candidate, then we're not going to hire you. But we also will, if we have an opportunity, if there's a candidate that's really great and we don't have a job, we may make a job for them because they're the best fit. So I don't know, that's a kind of a long question, but really we're committed to employees who are aligned with the values of the organization, which is, high quality, best quality practice, committed to supervision and consultation, evidence-based treatment, a wraparound approach, a team player, but most importantly, someone that is going to provide the best services to the kids and families we have the privilege of serving.
Thank you very much. Are there any questions for Megan? Maybe we got time for another one before we roll on. Thank you, Megan.
Welcome.
Oh, there's one. Just like that, it pops up. Are there
interesting. We'd love to expand to Western Kentucky when the opportunity arises that's the right opportunity for us. So our leadership team is really committed to opportunities that are the right opportunity. We're not going to expand just for the sake of expanding. You guys have pretty incredible providers there. And so if an opportunity does come up, we would love to do that. I didn't mention one of the great programs that was a pilot program in 2017 and is now expanding to Franklin, Trimble, and let me look at what the other county is. Franklin, Trimble, and Spencer counties is called K-STEP. It's Kentucky Strengthening Ties and Empowering Parents. It's part of the continuum of care in the child welfare system to work with families where the primary risk of removal is due to parental substance use. So we have not, that's always been a carve out of our family preservation programs. And we worked with the cabinet and worked with the feds to design this program called K-STEP, where we're able to provide long-term intervention in a wraparound approach. So different levels of care for families whose children are at risk for removal from substance use. So that we have openings actually in that program for bachelor's level and master's level. And you can go to, I put our website, kvcky.org. Up at the top right, there's a hyperlink to something that says careers, and you can sort by state and find those positions if anybody would be interested. And I do see Kaya's got a private chat to me, and I will message you back about connecting you with someone.
Cool. Thank you, Megan. Appreciate that very much. Appreciate that. All right, DCBS. So let me pull up. I think we got a couple slides here. All right, cabinet. Let's do it. You ready, Marjorie?
It's gonna be hard to follow Megan. Don't ever put me after her again.
Hey, y'all were picked by random selection, right?
I know. I watched your video. I know it was random.
Together, we're partners.
Oh, I know. We're totally partners. I'm just saying. I mean,
it's all good.
Megan's taking all my people right now. This is going to be really hard to follow. I'm just saying. Like, I'm thinking, man, do I want to go work for
Well,
Megan?
hey, I didn't recruit, but you are welcome.
Okay, so yeah. But Megan's a rock star right now. But anyways, I need you guys to really think about coming to work for DCBS, because we're the ones that kind of contract with Megan for what Megan does.
Yeah.
But my name is Marjorie Schuler, and I work in the commissioner's office for DCBS, and I'm the staff assistant for the deputy commissioner. And what I do is I do all of our hiring and personnel and all that kind of junk, not anything that you guys really care about. So we're gonna kind of skip talking about me, but I've been with state government for 20 years. It'll be 20 years in July, actually. Oh, it seems like that's been a really long time. But I don't want you guys to think that I'm here really to talk about HR stuff, because I'm going to talk to you about our agency. But I have actually done the work. So I don't want you all to think that they picked me because I hire people, but I actually worked as a frontline social worker, and I've been a supervisor, and I've worked for foster care and adoption. So I know the work. So I want you all to know that. So anyways, so I'm going to talk about our mission, which is on the next slide. Yes, it's on this slide too. It's also on the other slide. So our mission of DCBS is to reduce poverty, child and adult maltreatment, to advance individual and family self-sufficiency and recovery, to make sure that all children have safe and nurturing homes and communities. And what I'm really here for today is to recruit and retrain and retain a workforce. So I need people that Megan doesn't take. So that's my goal. We do have over 4,400 employees in DCBS, and so we are very, very large. So we are the state government agency that actually oversees child welfare, pretty much. So we're going to talk about that. But within DCBS, we have 5 divisions. We have the Division of Family Support, the Division of Protection and Permanency, the Division of Child Care, the Division of Administration and Financial Management, and the Division of Service Regions. So within the Service Region Division is what we're really going to talk about, because that's where you guys are going to be. You guys are going to be within the 120 counties. We have an office within all 120 counties across the state. So if you want to work in our family support program area, or if you want to work within our protection and permanency program area, you can do that. So we'll talk about that.
Tell me when you want me to go to the next slide.
You can go to the next slide.
Okay.
That's fine.
Yeah,
That's where we're going to talk a little bit about how we serve our families.
The next one, or?
This one's fine right here.
Okay, you got it.
So our family support staff, we're just briefly going to talk about that because they work very closely with our protection and permanency staff. Our family support staff are the folks that actually provide the services for medical and child care and SNAP, which is the food benefits within our local offices. Okay. So they help our families with self-sufficiency, our individuals and our families with children and that kind of stuff. So they are co-housed mostly in all of our 120 counties with our protection and permanency staff. Our protection and permanency staff are our social service worker staff who work for child protective services, adult protective services, and the foster care and adoption teams. So those staff are the ones who actually work to ensure that children and adults are safe, that we meet permanency, well-being, safety outcomes, that we do the investigations of child abuse and neglect, adult abuse and neglect, and that we recruit, we train foster homes for placements for when we take children in out-of-home care. Like Megan says, that is not our goal. We do not want to remove people's children. We try to do that like as a last resort. We use a lot of creativeness sometimes. We use relative placements. We use fictive kin now. Different placements. Sometimes we have to take them into out-of-home care and they go to foster homes, residential placements, and things like that. But anyways, so those are the services that we provide in terms of our agency to the families and children across the state. Okay, you can go to the next slide. Thank you, Austin.
You're welcome.
So what I want you guys to understand is you don't have to come in and be a CPS investigative worker. Okay, you don't have to come in and be a CPS ongoing worker. So depending on your skill sets, folks come in to our agency and they think, oh, I have to do this job. Well, we have centralized intake. So that is the team where our folks go and they take the reports of abuse and neglect. They're like on a hotline system. They take all the information. They determine against policy that we have whether or not the investigation or the information that they have meets in terms of being an investigation. And then they send that to the local offices. We have ongoing teams where folks are assigned cases where they work with the families, support services in the home to keep the families together, where they make those referrals to KBC, to the community mental health agencies, just different places like that, for the families to be able to do parenting classes and in-home services and therapy and substance abuse treatment and that kind of stuff. So that way they can keep reunified and be all safe together at home. We have the investigative teams where they do the investigation and they determine whether or not abuse or neglect occurred. We have specialized investigative teams where staff actually investigate foster homes, because sometimes we get investigations on foster homes, we get investigations on residential facilities, we get investigations on employees, we get investigations that are fatalities or near fatalities on children. That's kind of scary stuff, but we do. It's reality, it happens. We have teams that actually train and recruit foster homes. So those would be our teams that work with foster adoptive parents. We have staff that work with older children that provide independent living services for those kids who are older, who are in independent living placements, who have extended their commitment sometimes for educational purposes and are still within the custody of the cabinet and doing that for to go to school and that kind of stuff. Plus, we have our adult protective services teams, and they investigate abuse and neglect, exploitation, and things like that for vulnerable adults. So those are some skills and different kinds of positions that we have. And we always have positions. Let me just note that. Always available. Next slide. So this is just some stuff that we have available for our staff. So you don't have to, I don't want people to think that they come in and they're always going to be a social service worker 1, because people are like, oh, so what do I do now? We have reclass opportunities, so you can reclass to social service worker 2. We have clinician level positions. We have clinician level 2 positions. We have social service specialist positions. We have supervisor positions. We have regional leadership positions. We have positions in our other divisions, which I just talked about. Now that we are telecommuting, which I'll talk about on the next slide, we have a lot more availability for folks to apply for positions that are in our central office location, because you're not having to drive to Frankfurt every day, and be on those other teams where you can work in the policy sector of our department. We have prevention services type positions. We have case reviews, quality assurance, all kinds of different things like that. So you don't have to leave us to do something different. You can move around, find something else that you like to do. You can promote up, that kind of stuff. Okay, next slide. Okay, so this is just some of our benefits, just to maybe make you want to come apply for our jobs. So right now we are doing some telework stuff. That is because of COVID, but we are also keeping our telework and our flex scheduling post COVID, because we have found that it works very well for our social work staff. So we have actually started combining some of our offices, and we are assessing office closures in some of our counties, and merging some of our family support and PNP offices. So we don't need 2 offices in a county when we can just have 1 office there. So folks are working from home. They're doing a rotating schedule. So maybe they come in the office 1 day a week, and they work from home the other 4 days a week. Or we've got some family support staff that work from home 5 days a week and they don't come into the office. So we've got some flexibility there. We get a lot of annual sick and comp time accrued, which is very nice if you need to take off work for family or other obligations. Our training that we do is a contract through Eastern Kentucky University for our academy program. And so we do have opportunity to get master's level credit through our training program. So you could gain some credit hours there going through our training. Our training that we do is online now, and so you can do a lot of that virtually, but then also you get to go into the office and go out with seasoned staff. So you're doing a lot of hands-on training as well. And so we've had a lot of people who still are staff, I'm just saying, and their feedback to us is we still your staff because you all train them well. And they already have experience working with the populations that we work with. So that is a positive to us that we are training our staff well and that they already have experience working with all of these different types of case issues. So once you're with us, you're going to you're going to see like everything pretty much. I mean, there's probably not a case that's not ever going to come across your desk or your coworker's desk or somebody in your office's desk that you're not going to know about or hear about. We work with all kinds of populations, cultures, communities. It doesn't matter if people are rich or poor or whatever, you're going to work a case on somebody. So it doesn't matter. Anyways, people love us because we train great people. Anyways, we just wish we would get them to stay. So that would be my wish over here on my moving forward about resources. My last slide is actually how you apply. And so I'm going to leave that there while I tell you that if resources were not an issue, how I would expand the services to meet community needs. I would put money into our staff. Bottom line, that's what I would do. I would put money into recruiting and retaining more staff. I would expand funding to provide them with more benefits, focusing on making sure that they felt appreciated, because the job is very, very, very hard. It just is. It's thankless sometimes. So I would give them everything that I could give them. I just would. That's what I would do. I would give them lots of money, because if they're happy at work, then they're providing better services to our families and children. And then our families and children are having better outcomes. And then they're doing better in the community. And then we're not having or needing as many services for them. So anyways, I don't know if I have any questions, probably not, because I've scared you all off and you don't want to come work for me. But it is a great place to work, or I wouldn't have been here almost 20 years.
That's right. All right, Marjorie, let's see. We got some questions here. Emma Smith, what is some advice you would give to someone who will be working for the cabinet? Good question.
Somebody that's going to be working for the cabinet?
Yeah, for Emma Smith.
Give it time, seriously. Like there's going to be ups and downs and it's going to be hard. Especially when you first get there, you're going to feel like, oh my gosh, I don't know anything. But give it time. It's just going to be overwhelming sometimes. But don't forget about yourself. Take some self-care. Make sure you go to those people that have done the job, ask them questions, and make sure you talk to people. Don't just be like, I can't do this job and run away. Okay. Like really go to people and talk to them. Talk to anybody, like your team, your supervisor, everybody. Like there's people there to help you. I promise. Call me. I'll give you my cell phone number. I will help you. I promise. I have done the job. I love it. It's really great. I mean, it really is. One day I want to like teach about it, but I haven't got there yet. I got to retire first.
Marjorie, I would say too that the cabinet, the child welfare system in Kentucky is really doing incredible work to improve the health of the workforce. And so one of the benefits, right now there's a huge emphasis on self-care for employees, on supervision and training.
That's why I said take some self-care.
Diversity.
We have retention committees now, which we never had before.
Yeah.
We started those like 2 years ago.
Yeah.
Mm-hmm. Yeah.
I think there's a lot of reasons to get in on the cabinet work now, especially as we're looking at a more prevention focused child welfare strategy as a whole.
And we have a lot more resources. See all these people on the screen? These are our resources. Mm-hmm. We used to not have very many. We have lots of them now.
Yeah.
Like all of these people, they're great. I mean, you used to like have to dig for people to help you. These people are awesome. Like,
and
like
there's a wealth of knowledge in the supervisors at the cabinet
yes,
too.
it's great.
Yeah.
Like it's come a long way in the last 20 years, honestly.
Somebody wants the website.
Yes. Can you post? Haley Evans says, can you post the website? Marjorie, I don't know if you could do that, but that would be good if you could post the website. On
Yes, you want the website or the website to apply? Which website does she want?
Well, Haley, could you tell us? Or maybe we could just throw them both in there. Emma, I will say,
okay.
I will say this, because I can't help myself. Always remember your why. So I worked for the cabinet for a little while, and this is relevant, just really any position. And since we're finishing up here in a minute with our first annual Child Welfare Career Expo, my wisdom or guidance, just respectfully, would be always remember your why. Remember why you do the things that you do, right? So keep that near and dear to your heart. Always remember your why, and just kind of keep that and hold that dear to you, because yeah, times will get tough, but you're truly making a difference in the lives of people. And that's not something that everybody can maybe say, but you will. And you do. That's a good thing. So just remember your why, and always keep that near and dear to your heart. That's a big thing. That always resonated with me, and it still does. And that's why we're doing this today, because this is our why. It's what we're trying to do, trying to help people out.
And you're really doing a good job for people. You really are. It's a important job, honestly. It might not feel like it sometimes, but it truly is. I promise.
Absolutely. Okay. All right. So this is what I want to do as we get ready for Stephen. There's a little button down here for reactions, and I want to do a I don't know, we got to give Stephen a reaction, because Stephen is coming up with Maryhurst, and he is patient and he's wonderful. He's going to bring us home here in just a second. So everybody give him some love or some thumbs up or celebration or clapping or something. I mean, do something for him, because Stephen, it's your time. We're going to do it right now. Okay. Or yeah, or just a round of applause like this, right? All right, so let me show the logo that I've got for Maryhurst, and then Stephen, the floor is yours, and I will quit talking. So let me go ahead and share this. Appreciate everyone, and this is the logo for Maryhurst. Excited to have Maryhurst. And Stephen, can you talk to us, please?
All right. Well, first of all, I don't mind going last, because I just enjoyed all the other presentations. There's a lot of great organizations that have presented tonight. We work closely with a number of those organizations, and they're all doing great work. They would all be great places for you to start your career. I'd love for you to start your career at Maryhurst, but I thank you all for the fact that you're interested in coming into this field. I always tell people that I'm always trying to recruit people to work at Maryhurst, but I'm also trying to recruit people to work in our field. And so great that you all are interested in doing this, and that you're studying in this area. So a little about me first. I'm the Vice President of Human Resources at Maryhurst. I've been at Maryhurst for over 35 years. I started out working directly with clients. I was a youth counselor, shift supervisor, program supervisor, worked directly with clients for about 7.5 years before I moved into administration after getting my master's degree. Did quality improvement for a while. I coordinated us getting nationally accredited back in the early 1990s with Council on Accreditation. Then was asked to take over human resources in the mid 90s, and did both of those things for a while until we got a lot bigger, and then stuck with human resources when we split that up. Our vision at Maryhurst: communities free of abuse and filled with hope for every child and family. Our mission statement: to strengthen and empower children and families in greatest need. Now, I don't know if I'm the oldest presenter tonight or not. I probably am, looking at faces, but I can tell you I'm from the oldest agency. We've been around since 1843, so wow. 178 years old. Wow. Founded by an order of Catholic sisters called the Sisters of the Good Shepherd. They were a French order, and we were their first work in North America. There are a number of child welfare agencies in Kentucky that are almost as old as we are. Most of those agencies started out as an orphanage. We didn't actually start out as an orphanage. We were really founded to deal with the exploitation of women and girls. And that was the mission of the sisters, and still very much their mission They're in 73 countries around the world today, very involved in the fight against human trafficking, for example, around the world. They turned the ownership of Maryhurst over to our board of directors in 1998. So we still have a very close relationship with the sisters, but we're not owned by them at this point. We are a Louisville agency. I know some of the questions that have popped up with different agencies and where you're located, things like that. We are a Louisville agency. We basically do two things. Our newest program, which we've been doing for about 6 years, is outpatient counseling. And we're excited to be working with children who are living with their families, but who need support in a way that helps those families continue to be successful. Like some of the other agencies that have talked tonight, our staff in our outpatient program, some of the clients come to one of our 3 offices in Louisville, but for the most part, we're either going into their homes or we're meeting with the kids in the schools and have partnerships with JCPS, the Jefferson County Public School System, that have described, that similar to some that have been described in other counties as well. For those of you who are finishing up your master's degree, our outpatient counseling program is growing faster than we can keep up with. We are looking to hire about 5 therapists right now. And so I would very much encourage you to apply. I would encourage you to go ahead and apply now. You don't have to wait till you graduate. We'd be happy to go ahead and interview you. And then we'll slot you in to start whenever you're ready. We do pay, we either provide for or pay for the clinical supervision to help you get your LCSW or whichever L you're working towards if you're in another program. So right now we have therapist positions open in our outpatient counseling program. We also have 1 therapist position open with one of our group homes as well. The other service that we provide, and what Maryhurst is much more known for, is that we do residential treatment for adolescent girls who are victims of abuse and neglect. So these are children that are placed with us by DCPS. We can serve about 100 adolescent girls at a time. We're not the largest residential treatment agency in Kentucky, but we do serve more adolescent girls than any other agency in the state, and have partnered with the state for many years to serve some of their most difficult to serve adolescent girls. Many of the kids we serve in our residential program are kids for whom the system has not worked. They've been in 15, 20, 30 places before they get to us. Foster homes, other residential facilities, in and out of psych hospitals, and it just hasn't worked. And so we're trying to move that in a better direction. 2 words that I use a lot are trauma and permanency. Trauma is what our kids have experienced. Permanency is what we're trying to help them get to. For those of you who are finishing up your bachelor's degree, there's a number of positions that would make sense for you. In our residential treatment program, the entry-level position is called youth counselor. And I will tell you that we're playing with the possibility of changing the title a little bit. So if you go to our website in 3 or 4 weeks and it's different, you know that we are discussing that. But we've been calling it youth counselor for a long time. That's an entry-level position working in our residential treatment programs. We also have a couple of other positions. One's called therapeutic behavioral support specialist. Those are folks, so whereas the youth counselors work with all the girls in a group, so it could be one of our cottages on our main campus or one of our group homes, the youth counselors are working with all the girls in the group. A therapeutic behavioral support specialist is doing one-on-one with one child in that group. And so that position does one-on-one work in the residential treatment programs. We also have a position called community support associate. Those are folks who do one-on-one services with children in our outpatient program. So in addition to the therapists who are going into the home and doing therapy with the child, the community support associate would be somebody who would be going into that home and spending several hours a week with that client, helping the client be successful in the home or in the school setting as well. So again, for those of you finishing your master's degree, we have several clinical therapist positions that we're hiring for right now. If you're finishing the bachelor's degree, the youth counselor, the therapeutic behavioral support specialist, the community support associate position. Trying to look at my notes here on some of the questions. Well, someone mentioned earlier, I think it was Natasha from Home of the Innocents mentioned the sanctuary model. That's part of something called trauma resilient communities. And there are a number of agencies in Louisville that are very involved in the trauma resilient communities program. Home of the Innocents is one of them. Maryhurst is one of those as well. And that's something we're very excited. We've been doing trauma-informed care since about 2007. We were the first private agency in the state to move, a residential agency to move to a trauma-informed model. But we're now moving from an older model we have to that TRC model, and we're excited about that. If resources were not an issue, how would you expand services to meet community needs? One of the things that we've just started expanding, and we're working hard to have the resources to continue this. When I did my master's thesis years ago, I did it on residential treatment. And one of the things I learned was that the most predictive indicator of whether or not residential treatment would be successful was not the residential treatment. It was the aftercare that was provided. And yet in most states, aftercare has never been paid for. So we've done a lot of raising of private funds to do more aftercare services. And if resources were available, that's where we would expand to do more, provide more services to children as they're leaving our care to help them be successful as they're moving, whether it's back to family or to an adoptive home or you know, wherever they're going when they leave us. Again, we're trying to work them toward permanency. Permanency may be back to someone in their family, maybe fictive kin, it may be an adoptive home, but we're trying to get them to something stable in with someone that's going to be there and be there for them the rest of their lives. All right, I'm talking fast because I saw that, you know, we're running out of time here.
We're good.
Oh, go ahead.
Are there any questions or anything for Stephen? We're good. We're good. Any questions for Stephen? Okay. Thank you very much. Thank you very much
for the opportunity.
Yeah, absolutely. Well, let me go ahead and wrap this up. Let's do another reaction right now, and then I'll say 2 or 3 things for about half a minute, and we'll be done. So let's all throw up a thumbs up or celebration or something, right? We'll show some love real quick. So what I want to say is this: I appreciate each and every one of you. Definitely want to thank everyone for all of your time, right? So we all got decisions to make. So want to thank all the agencies for their time and also for everything that they do. It really matters to all of us. Thank you so much for connecting with all of our students and with us. Really and truly thank you. Thank you for our students. Thank you for choosing WKU, right? Go Tops. Also, thank you for being passionate about improving the lives of family and children. I mean, that really, really matters. I want to thank my team for helping us to do this, especially Julie Jones, Marsha Hopper, and Chelsea Hale. So thank y'all so much. It really matters. It's the first time we've done it. We're going to try to improve because we always want to improve. And kind of that's one of the last things I'll say here is that we will be sending a survey out to everybody. It's anonymous. We're not trying to identify folks because we're not. We just want to get some feedback because we want to improve, and we think and believe that this is valuable, and this is something that can be valuable for agencies and students and for all of us from a community approach. And on behalf of a friend, former Commissioner Eric Clark, he always used to say child welfare belongs to all of us. I believe that, we believe that. And if you just kind of look around yourself on this video here, child welfare belongs to all of us. So we just want to say thank you all. I don't have anything else. And so what we're going to do is we're going to sign off. We're going to tell everybody that we appreciate y'all very much. Okay. Y'all have a wonderful night. Thank you.